start out with the back of the leg. We'll start from the bottom and move up with the calf stretch. So you can either do this on the floor, or you can do it as I discussed before, on the side of the bed. So if you're going to be doing the left leg, and you want them closer to that side of the bed, and you can just have them roll over and go to the other side. But in this case, we'll start with the leg straight. Try not to put too much pressure on their knee, and then you can just do a slight stretch back. You feel a stretch back? So you never want to, with the legs straight like that, you never want to really torque, because it also stretches the nerve at the same time, so it can be pretty painful. When we do therapies on people, we do neurofascial stretches, which is a more intense version of the stretch. So just slightly pull their toe back. They should feel it almost right away, unless they have crazy loose calves, which I don't know if it does. And then traditionally, stretching the hamstring, you think of like touching your toes or reaching and, with your legs straight. And a lot of times you feel the pressure on the back of your knee as opposed to where you want to feel it in the muscle. Now, with any stretching, it's just like adding a link in a chain. No matter where you stretch it, it's gonna make it longer. But it's more important to get it in the area that you need it the most, which is more the belly of the muscle. So I always try to get the person in with their hip flexed so that their knee is up, and then I'll put my shoulder into it and then start to straighten out the leg from that position. As you can see, she's still got about a 45 degree, and you can feel it right in the medial muscle, right? If you're not in a position to put your shoulder into it, you can just hold their leg like that and then bring it up. Generally, they should feel it right away, unless they're crazy flexible, which some people are, some people aren't. So you just have to go with your feedback. From this position, you can also go into the glute or hip stretches, which you just want to take their leg at a 90-degree angle and just rotate it in, and you probably feel it. If they are like, oh, it's not bad, you can add a little bit of pressure, but make sure you're evenly pushing. You can get their leg almost straight that way, but that puts a lot of torsion on the outside of the knee. So I prefer to just kind of keep it at a light angle where I just feel resistance, and then I'm pushing. And if they're not feeling it too much, you can change the angle of it, whatever works best for them. And it's important, if you're getting stretched out, to keep your hip as relaxed as possible, because you'll get a lot of pinching in the hip if you're trying to help them and pull your leg up. So just try to be dead weight if you can. So you can go right in from these hip stretches to a lower back stretch. All you do is place their ankle next to their knee and then just rotate them over. If they have any pain with rotation, don't do it. It could be bothering some aggravated discs in the back or any other lower back issues. But generally it helps not only stretch the hip but the lower back as well.